Struggling to get a good night's sleep? Imagine waking up dozens of times, gasping for air and not even realizing it. For many dealing with obstructive sleep apnea, OSA, it's a nightly reality. OSA disrupts sleep, and when left untreated, it can lead to serious health issues like high blood pressure and heart disease. Enter CPAP therapy, a solution that could change your nights and improve your days. But here's the real question: how can you access it, and will Medicare help with the costs? If you're on Medicare, this video is your essential guide to understanding how to get the CPAP coverage you need. Section 1: Understanding obstructive sleep apnea and CPAP therapy. OSA, or obstructive sleep apnea, happens when your airway repeatedly closes or gets blocked during sleep, leaving your body without enough oxygen. You might not realize it, but you're waking up over and over again throughout the night. This interrupted sleep isn't just frustrating, it's unhealthy. Symptoms like daytime fatigue, mood swings, high blood pressure, and even heart issues can all trace back to sleep apnea. So, how can you treat it? Continuous positive airway pressure, or CPAP therapy, is one of the most common treatments for OSA. A CPAP machine keeps your airways open by delivering a steady stream of air through a mask. For many, it's a game changer, allowing them to sleep soundly and wake up feeling refreshed. But getting a CPAP machine isn't as simple as picking one up at the store, especially if you're relying on Medicare for assistance. Section 2: The Medicare Connection, Initial Steps for Coverage. To qualify for Medicare coverage, you first need to be diagnosed with sleep apnea. This typically involves undergoing a sleep study, either in a lab or at home, using a specific type of sleep monitoring device. If your sleep study confirms that you have OSA, you're on track for Medicare-covered CPAP therapy. Medicare, specifically Part B, will usually cover a 3-month trial period of CPAP therapy. During this trial, Medicare pays for the equipment you'll need: the CPAP machine itself, a mask, tubing, and nasal pillows. But remember, there's a catch: you have to meet your annual deductible, which is around $240. Once you've paid that, Medicare covers 80% of the trial costs, leaving you responsible for the other 20%. Section 3: Medicare coverage requirements for CPAP therapy. Let's dive into the requirements for Medicare coverage. First off, your doctor and CPAP supplier must be enrolled in Medicare. And after your diagnosis, Medicare needs to confirm that your sleep apnea is significant enough to qualify for CPAP therapy. Here's how that works. 1. Apnea-Hypopnea Index, AHI. If your AHI score is 15 or higher, you likely qualify. 2. RDI score. If your respiratory disturbance index is between 5 and 14, you may still qualify if you show other symptoms like daytime sleepiness or high blood pressure. If you meet these criteria, you'll be eligible for that 3-month trial we mentioned. But here's the thing: Medicare requires you to stick with the therapy. The idea is to make sure CPAP is truly helping you. If, after the 3-month trial, your doctor documents that CPAP is improving your condition, Medicare can extend coverage. Section 4: After the trial period, long-term CPAP coverage. If CPAP therapy is working, you may wonder, what happens next? After your initial 3-month trial, Medicare may continue covering the cost of your CPAP machine for an additional 13 months, with the same 80-20 coverage split. After 13 months, you'll actually own the machine. But to keep this coverage, there are a few rules you'll need to follow. 1. Stick with it. Medicare requires proof of adherence. That means you'll need to use the machine for at least 4 hours a night, 70% of the time. 2. Check-ins. Your doctor will need to verify that CPAP therapy is helping. If at any point Medicare determines that you're not using the machine consistently, they might cut off coverage. Medicare's approach is like a probation period for your CPAP machine. They want to make sure it's not just gathering dust on your nightstand. Section 5: Understanding the costs, coinsurance and deductibles. So, what will it all cost? After you meet the Part B deductible, Medicare will pay 80% of the approved amount for your CPAP machine and supplies. you're left with the remaining 20%. Here's a quick example. Let's say the Medicare approved amount for your CPAP machine and accessories is $500. Medicare would cover $400, and you'd be responsible for the remaining $100. If you have additional coverage through Medigap or Medicaid, that could help cover this co-insurance cost. But keep this in mind, Medicare only pays based on the approved amount. If your supplier charges more, you could end up paying the difference. Make sure your supplier accepts the Medicare assignment, which means they'll accept the Medicare approved payment rate. This can help you avoid any unexpected out-of-pocket costs. Section 6. Medicare Advantage Plans and CPAP Coverage. Many people have a Medicare Advantage plan instead of original Medicare. These plans, offered by private insurers, must cover everything that original Medicare covers. In most cases, that includes CPAP therapy. However, rules may vary regarding the brands and types of equipment they'll cover. Some plans may also have specific supplier networks, so check with your insurer to understand their requirements before getting your equipment. Advantage plans can sometimes cover extra items that original Medicare doesn't, like replacement masks or accessories, which are essential for CPAP maintenance. You may have slightly different co-payments, but if you work with your insurer and doctor, you'll likely be able to get the equipment you need without surprises. Section 7. What you need to know before you get a CPAP machine. Here are a few final things to remember as you begin your CPAP journey with Medicare. Stay consistent. Adherence is crucial. If you stop using the machine, Medicare might stop paying. Keep up with supplies. You'll need to replace your CPAP mask and other accessories periodically. Ask your supplier about replacements so you don't have to worry about covering those costs yourself. Check your plan. Medicare Advantage plans vary widely. Make sure you know what's covered so you don't get stuck with unexpected bills. It may feel a bit overwhelming, but rest assured that once you understand the basics, Medicare and CPAP therapy can work together to get you the restful nights you deserve. Conclusion. OSA can affect every aspect of your health. But with CPAP therapy, you can get the relief you need and Medicare can help make it affordable. By understanding the steps, costs, and Medicare's requirements, you can take control of your health journey. Sleep shouldn't be a struggle, and neither should getting the care you need. Now that you know the ins and outs of Medicare's CPAP coverage, you're ready to make the best decisions for your health. Be sure to subscribe for more on health coverage, and hit the bell so you don't miss any updates. Here's to restful nights and brighter days ahead.